With the hips that I had over the period of time, everything was bad. It seemed like every movement or any long stand that I had to take was really a bad movement, was a bad thing for me. Trying to bend down to tie my shoes, I found that over time I was tying my shoes and the knots were getting closer and closer to the inside of my foot because I could not bend down far enough to get them tied straight. And putting on socks was an ordeal, going up and down stairs, walking on concrete for any period of time. It was just an ordeal. It was painful. I love to golf, and I've golfed all my life. I also am a JV golf coach for the Hudson High School. And golfing is a lot of walking, and golf coaching is a lot of standing. And both of those were bad on the hips. At the end of each season, in golf, I would take 2 months off because I just couldn't go any further. It was just starting to take quite a toll on my hips, and it was getting to be too much pain for me to bear. So that's why I decided to have something done. I went to Crystal Clinic down in Cuyahoga Falls and met Dr. Kepley, and he's taken care of me since.
Diagnosing hip joint problems can be fairly straightforward if you have a grasp or an understanding on where the body will refer its pain symptoms. Hip joints cause pain almost exclusively in the front of the leg, in the groin area where the leg essentially joins the rest of the torso. Hip problems also tend to refer their pain down the thigh and towards the knee. So patients presenting with a bad hip will have pain in the front of their leg. They'll also complain of a lot of stiffness, difficulty crossing legs, difficulty putting on socks or tying shoes. When Ted Conlon presented, he basically had problems with both hip joints and one knee joint. His hip joints were his most pressing problem, causing pain with his daily activities as well as affecting his golf game. So we elected to replace his hip joints first, one at a time, about 2 years apart, and he got through those remarkably well. And then just this past December had his knee joint replaced and did remarkably well with that.
Dr. Kepley's a nice man. What impresses me, besides his appearance, skills, which are wonderful, is when you go into his office and you talk to him, you aren't rushed. He'll spend as much time as you want to talk about your ailments, and he'll get to understand you as a person, not just a patient, not just a number. He'll understand why you want to do what you want to do and how the pain is stopping you from doing it. He's a very nice gentleman, and my wife and I really enjoy meeting him over the years.